Good evening, and thank you so much for joining me. I know that you had a few concerns over your health lately, so I'm very glad that you could just stop by for a quick appointment just to ensure you that everything is fine, just so you can go about your daily life with a sense of calm and relaxation. So, I am going to be going over a few simple tests with you to perform a cranial nerve exam. So if you could just follow along with me as I perform these tests, that would be absolutely fantastic. So first off, I'm going to hold up my fingers just like this, and I will wag them like such. And what I'd like you to do for me is tell me which fingers I'm moving left or right when I do so. Okay? Perfect. So let's begin. Good. That's right. Excellent. Okay. Okay, that's right. So, at least the beginning seems to be going well, and we'll move on to the next part of this examination, which is simply just following along with my fingers as I trace the air. So if you could just follow along while staring directly at my nose, that would be perfect. Okay. Good. Good. All right. Are you experiencing any issues or noticing any kind of blurred vision as I perform this task? Okay, good. Everything seems to be functioning normally there, which is great and fantastic news. So I'm just going to go ahead and gently place my hands on your face, and I want you to tell me when and where you can feel me just gently touching upon your face, just to make sure that all the nerves and muscles are functioning properly within your facial region. So, you can feel that. And right. And how about that? Excellent. And right about here. Okay. Anything there, feeling any type of pain or no? Excellent. And what if I apply a little bit of pressure on? Okay, perfect. And how about that? You can feel that on your left side. And how about on the right? Good. So it seems everything so far is looking really good, which is a positive sign for you. So next we are going to test your auditory senses, just to ensure that everything is functioning okay there, because sound is also tied to your cranial nerve. So I'm simply going to go ahead and rub my fingers together just like this. And I'm going to want you to close your eyes and tell me which side you hear these sounds coming from, okay? Good. So go ahead and close your eyes. Go ahead and close your eyes. And let's begin. Good. That's right. I tried to trick you there. That's right. Yes. Okay, so you're definitely hearing both these sounds correctly, which is perfect, and another great sign that your health is in great check. So you can just calm, become relaxed, and enjoy the sounds. So again, while testing some of the auditory senses, I'm going to be using this tool to create a vibrating low frequency, and I'd like you to tell me when you can hear it and when the sound dissipates, okay? Perfect. So let's begin. Good, good. Okay, so you are hearing this loud and clear. So what I'm going to do now is test both of your ears, and as you hear the vibrations, I'd like you to tell me which ear you are hearing it from. But I'd also like you to close your eyes for me as I perform this next portion of the test. All right? Perfect. Here we go. Excellent. You can hear that sound moving around you. I've had some of my patients tell me that these vibrating frequencies seem to almost have a healing type property to them. So I hope you're benefiting from some of this vibration. must tell you, everything seems to be looking rather well with you, and I feel like there's not much need for concern, as all the basic tests of a cranial nerve exam have seemed to turn out fine. I know that sometimes in our lives, extra stress may lead us to believe that we are having certain ailments that we might not actually be having, rather just feeling. So I would encourage you to maybe take the next day off that you have, or weekend, and really try to focus on yourself, unwind, maybe prepare a nice day of relaxation that includes a bath, a nice meal, perhaps a warm cup of tea. Great. Was there anything else that you wanted me to take a look at while I had you here? Okay, so you're feeling a little bit of stress and arrhythmia in your heart. I can definitely take a listen to your heart and just see that everything is okay. So let's just take a little listen here and see what's going on. Okay. Everything seems to be sounding really good, actually, and I feel like your heart is actually in great shape and condition compared to a lot of people that I have come in. Really nice, yeah. I always found a heartbeat to be so soothing. Reminds me of being a child in the mother's womb. Do me a big favor and just take a big deep breath in for me. And exhale, yes. Okay. And one more time for me, please. Excellent, excellent. And one more time for me, please. Good, good. Well, the good news is that you are in excellent, excellent health, and there is no cause for concern at this time. But like I said, I would recommend that perhaps you take some time to focus on your mental health, and perhaps I can give you a mild prescription just to help you relax when you're feeling maybe a panic attack or some kind of negative mood. But you are also always welcome to book an appointment with me, as I am here to help you, to reassure you, and to let you know that everything is okay. Alright? Good. So I'm just going to go ahead and punch in some of this information that we've gone over today. just so I can keep some of this for my records for when you come in next time. A service that we are also offering here will be available to you next week, which is a free facial massage and relaxation therapy that we're giving away as a test trial to some of our patients here. So if you'd like to come back next week, I'd love to book you in for an appointment to just help you fully relax in a different way. How's that sound? Good? Great. So I'm just going to go ahead and book you in for next week. For Monday at 7:30 p.m. So we've gone ahead and set that for you. Was there anything else I could help you with today? No? Good. Well, it was an absolute pleasure to see you today, and an even bigger pleasure to give you that sense of relief and calm. I hope to see you again very, very soon. Well, Monday actually. So we'll see you then. Until then, have a great night.